Coming off shift, I go to call my wife to talk to her before she goes off to work. I reach in my pocket and my phone's almost dead. I know I'm expected to talk to her as long as she wants. What do? You can be mindful as much as you want. We've all let the battery run low and then need it, praying there's just enough left to do what you need it to do. The battery is like your emotional battery. It only has so much to give until there's nothing left. In nurses, when the battery dies, that's what we call compassion fatigue. Hi, my name is Thomas Holloway, and thanks for coming by and letting me talk about compassion fatigue. In nurses, we are carers. We give out our emotional resources. Eventually, without a recharge, there's nothing left to give. What it is not just being tired or not wanting to care. You don't want to ignore your wife, but your cell battery has nothing left and it ends the call. And now you're going to get it when you get home. We combat this through education, self-care, self-identification, and that's kind of the hard part because you're so close in the situation. It's easier to see it in others, but remember to tell the habitual drainer to charge their battery. Watson rooms can be developed at your workplace. They are places to decompress. They're homey, inviting, tech and stress-free. A place for meditation breaks, a little 4-minute chance to recenter during shift. Also, people take your breaks off the unit. Get away. You can decompress after shift before going home. Journaling. Find someone to talk it out with. Find what works best for you. Also, how do you recharge your phone? Are you a slow trickle overnight charge? This would be journaling, talking it out, finding a creative outlet. Or are you a quick top-off charge several times during the day? Those are quick mental breaks during your shift. Take a walk, take your coffee outside. The big thing to remember is don't let your phone get to zero. Because remember, you have to wait for it to get some juice before it's usable again. I've had 20 years in mental health. I've seen it in myself. I've seen it in coworkers. It's contributed some of my own burnout. I've watched it in others who have not been able to handle it and had to leave the profession altogether. In moving forward, I want to find ways to treat the team to be cohesive. Decompress after the shift and find people who know what you're going through. Remember, we're in this together. I've seen things like team breakfast or team outings, and I've noticed a difference when it stopped or a lack of follow-through. It's helped create that team bond, and those people have lasted longer. You need to identify the biggest battery drainers. And for me personally, I've had to learn to not take it personally when a patient's lack of progression and they have become a repeat admissions. As far as schools, we need to reinforce the ability to recharge and to teach actively the decompression skills and not just talk about it. As far as workplaces, we need to help create Watson rooms, facilitate and support their use, create buy-in and support with management for shift or mental health breaks. Emotional batteries are like cell phone batteries. Find a way to recharge them. Once it's dead, it takes longer to be able to use it again. And remember, once drained emotional battery, it will take longer to function. And in nursing, this is compassion fatigue.